PhysioScholar provides you access to an anatomy section, Dynatomy. You can see in the top toolbar here when you're logged in, if you click on the anatomy section, it will take you through to this page, and you can choose then between muscles or joints. So say we were to choose something in the muscle section, then we would click through to the Dynatomy page. Please be aware that this Dynatomy package uses Adobe Shockwave. There are some difficulties using this in Mac, but if you are to log in with Firefox, then you can download Adobe Shockwave and then that will work. So in this case, we can be reminded later. We'll skip the intro and take you through to Dynatomy. So say we were to look then the left-hand side, the muscles. Let's look at some shoulder muscles. Let's look at the muscles, specifically serratus anterior. We can look at serratus anterior action, what it does, and I can scroll along from here where each layer is then added up. I can answer a quiz on serratus anterior. Serratus anterior forms something wall of the axilla, where I would then enter my results. I can also find out more about serratus anterior in the axilla, the winging scapula, as it relates to nerve supply, this part of the scapula, the lateral rotation, and then some information about the forescouple. So all this is available on the Dynatomy website, courtesy of PhysioScholar. You can also look then, say we were to look at other muscles. We could look to anterior muscles of the rectus femoris, and in the same example, muscles of the foot, where you could remind yourself of other muscles around the area if you've forgotten them. There's information also on dermatomes, this example here of the upper limb. If we are to move along here, then you see the different information as it comes through from Dynatomy. There are also information on the brachial plexus. And once again, by scrolling along here, we see different information here on the brachial plexus. If you wanted different information on the joints, then you would go back to the main page and click through joints. Again, this issue with Shockwave. And you'll go joints by region, upper limb, shoulder joint, some structure. And you would see here, as you were to scroll along, different layers of the joint that is put together. And all this is available for all other joints. You see in the lower limb, you then see sacroiliac, symphysis pubis, hip joint, knee joint, tibiofibular, ankle, subtalar, midtarsal, etc.